anti-inflammatory drugs in asthma and COPD. In the previous lectures of the respiratory block, we discussed the bronchodilator therapy in asthma and COPD. In today's session, we will discuss about the anti-inflammatory drugs used in the management and the prevention of asthma and chronic obstructive pulmonary disease. As we know that the inflammatory mediators are responsible for the bronchoconstrictions, formation of the mucus in the asthma and COPD. The role of anti-inflammatory drugs is to prevent the formation of inflammatory mediators, including histamine, leukotrienes, interleukins, and many more. The objective of today's lecture is, the first one is classify the drugs used in treatment of bronchial asthma and COPD. Describe the pharmacological basis of use of the corticosteroids and immunosuppressive drugs in the treatment of bronchial asthma and COPD, and identify the drug-drug interactions of drug used in treatment of bronchial asthma. In previous lectures of bronchodilators, we already discussed the pharmacology of bronchodilators and drug-drug interaction. The first objective is to classify the drug used in treatment of bronchial asthma and COPD. Let us see the classification. The first category is bronchodilators. As we discussed in the previous lecture of bronchodilators, that includes beta-2 agonist, anticholinergic, methyl xanthines, and magnesium sulfate. Today, we will discuss about the anti-inflammatory drugs which are used in the treatment of asthma and COPD. The anti-inflammatory drugs are categorized as, the first one is corticosteroids, and amongst the corticosteroids, inhalational corticosteroids are the first line agents. Examples of inhalational corticosteroids include fluticasone, budesonide. As these are the inhalational drugs, they will provide the targeted drug delivery to the bronchial smooth muscle. The oral corticosteroids are also used, including prednisone, prednisolone. And intravenous corticosteroids are also used, including methylprednisone and cortisones. But the inhalational corticosteroids are the first line therapy in the management of the anti-inflammatory mediators in asthma and COPD. Second category includes leukotriene receptor antagonist. Examples of leukotriene receptor antagonist include montelukast, zapirlukast, and xylitone. As these are the leukotrienes, which is an inflammatory mediators responsible for the inflammation. Third category is mast cell stabilizers. An example is cromolyn sodium. And the last one is methyl xanthines. Examples are aminophylline and the theophylline. Theophylline we already discussed in the category of bronchodilator. But in addition to the bronchodilator, theophylline is also plays important role in the anti-inflammatory response. The next category which are used as anti-inflammatory drugs is monoclonal antibody, and amongst the monoclonal antibody, omalizumab is the drug which generally act by anti-IgE antibody response. Let us see the drug one by one. Amongst the corticosteroid, as we know, inhalational corticosteroids are the first line in the prevention and the maintenance therapy of asthma. The first example is fluticasone. Fluticasone is available in the dosage form as aerosol for inhalation and powder for inhalation. Mechanism of action: anti-inflammatory effect on neutrophils, eosinophils, macrophages, mast cells, lymphocytes, and mediators including histamine, leukotrienes, cytokines, and eicosanoids. So generally, fluticasone inhibits the inflammatory mediators responsible for the bronchospasm. The indication of fluticasone includes maintenance and prophylactic therapy of asthma. maintenance. And it's very important, fluticasone is not indicated for relief of acute bronchospasm. We cannot use fluticasone in the acute attack of bronchospasm or asthma. Adverse effect of fluticasone includes oral fungal infection, we can say oral candidiasis, throat irritation, upper respiratory tract infection, fatigue, malaise, nasal congestion, rhinitis, musculoskeletal pain, and the headache. Contraindications include hypersensitivity to the drug, components or milk protein, which may result in anaphylaxis, angioedema, rash, and urticaria. It's very important. The status asthmaticus and the acute bronchospasm is also contraindicated because in the status asthmaticus and acute bronchospasm, we need to bronchodilator. We need the bronchodilators, and fluticasone is a not bronchodilator. That's why the fluticasone is contraindicated in status asthmaticus and acute bronchospasm. Caution: risk of infections of nose and pharynx, including Candida albicans. So it is very important, after use of the fluticasone, the patient should, or we can say must, patient must rinse mouth after inhalation to reduce the risk of infection. Next example of inhalational corticosteroids include budesonide inhalation. The dosage forms available as powder for inhalation and suspension for nebulizer. Mechanism of action: anti-inflammatory effect on neutrophils, eosinophils, macrophages, mast cell, lymphocytes, and mediators including histamine, leukotrienes, cytokines, and eicosanoids. We can say budesonide is an anti-inflammatory corticosteroids. Indications: budesonide is also used for maintenance treatment of asthma, maintenance, not for the acute. Adverse effect includes respiratory infections, rhinitis, otitis media, and oral candidiasis. Contraindications: documented hypersensitivity to the drug, status asthmaticus, and acute bronchospasm. So it means that inhaled corticosteroids are not recommended as a first line therapy for acute bronchospasm and the status asthmaticus, as these agents are not bronchodilators. Cautions: risk of infection of nose and pharynx, including Candida albicans, which is a fungal infection. So patient must be advised to rinse mouth after inhalation to reduce the risk of infection. Next category for the anti-inflammatory drugs used in the treatment of asthma and COPD includes leukotriene receptor antagonist. As we know that leukotrienes is responsible for the bronchospasm. The first example of leukotriene receptor antagonist is montelukast. Doses form include tablet, chewable tablet, and oral granules. Mechanism of action includes montelukast block binding of leukotriene D4 to its receptor, alters the pathophysiology associated with inflammatory process that contributes to sign and symptoms of asthma. Indication of montelukast: prevention and chronic treatment of asthma, prevention of exercise induced bronchoconstriction and seasonal or perennial allergic rhinitis. Adverse effects include headache, GI distress, rash, and the urticaria. Contraindications: hypersensitivity. Cautions: not to be given for acute asthma attacks, including status asthmaticus, and less than 12-month infants. Safety and efficacy not established. Therefore, it is recommended to use montelukast above 12 month of children's. There is an black box warning. What is black box warning? The warning is issued by the Food and Drug Administrations. Warning is issued by the Food and Drug Administration regarding the toxic effect of drug in the interest of the healthcare workers and public. Black box warning for montelukast include, and this warning is issued by the FDA in 2020, March 2020. Serious neuropsychiatric events after the use of montelukast. There is an serious neuropsychiatric events that may include suicidal thoughts or actions have been reported in patients taking montelukast. Only use montelukast for allergic rhinitis in patients who have an inadequate response or intolerance to alternative therapies. And it's very important, before prescribing montelukast, consider risk and benefits when prescribing or continuing treatment. So this is the new warning or latest warning in 2020 issued by the Food and Drug Administration regarding the use of montelukast. Second example of leukotriene receptor antagonist is zapirlukast. The dosage form include tablet, Mechanism of actions. Zapirlucast blocks the binding of leukotriene D4 and E4 to its receptor, alters pathophysiology associated with inflammatory process that contributes to the sign and symptoms of asthma. Indications of Zapirlucast includes prevention and for the chronic treatment of asthma. Adverse effect includes headache, gastrointestinal distress, back pain, myalgia, and infection. Contraindications of Zapirlucast includes hypersensitivity and the hepatic impairment, that is liver disease. Cautions: not to be given for acute asthma attacks, including status asthmaticus, and the not recommended in children less than 5 years because the safety and efficacy is not established. The most important note is that Zapirlucast is now discontinued in the United Kingdom from March 2018. Most important note. The next example of anti-inflammatory drug is Xylitol. The dosage form available as tablet. Mechanism of action. Xylitol is an inhibitor of 5-lipoxygenase, which inhibits the formation of leukotriene B4, leukotriene C4, leukotriene D4, and leukotriene E4, which leads to inhibition of leukotriene formation. So it's most important that we cannot say that xylitol is leukotriene receptor antagonist, but xylitol inhibits the leukotriene formation. This is the most important difference. Xylitol is not leukotriene receptor antagonist, but we can say xylitol is inhibits the formation of leukotriene. Indications: treatment of asthma, adverse effect, headache, gastrointestinal distress, myalgia. Contraindications include hypersensitivity and the hepatic impairment. Cautions: not indicated for use in acute bronchospasm, not recommended for patients less than 12 years due to risk of hepatotoxicity. Next category is mast cell stabilizers. Example of mast cell stabilizer is cromolyn sodium, or also called as chromoglycate sodium. Dosage form include oral concentrate, nebulization solution, and intranasal spray. Mechanism of action: mast cell stabilizer inhibits the release of histamine, leukotrienes, and slow reacting substance of anaphylaxis from mast cell by inhibiting degranulations. So we can say cromolyn sodium is the drug which inhibits the release of inflammatory mediators, including histamine and the leukotriene from the mast cell by inhibiting degranulation. Indications of the cromolyn sodium: include asthma, exercise or allergen induced bronchospasm prevention, adverse effect, gastrointestinal distress, migraine, cough, and fatigue. Contraindications include hypersensitivity, acute asthma attack, and status asthmaticus. So, cromolyn sodium is also not advised to used in acute asthma, acute bronchospasm, and the status asthmaticus. Cautions in the children less than 2 years, safety and efficacy not established. Therefore, do not recommend cromolyn sodium in the patients less than 2 years. Next category, monoclonal antibody. Example of monoclonal antibody includes omalizumab. Omalizumab is not a traditional immunosuppressive drug. Omalizumab is a monoclonal antibody and used in moderate to severe persistent asthma in patients with a positive skin test or in a vitro reactivity to a perennial aeroallergen and symptoms inadequately controlled with inhaled corticosteroids. Please remember omalizumab is a not of first line therapy. Omalizumab is recommended for the patients in which the symptoms inadequately controlled with inhaled corticosteroids and other bronchodilators. And omalizumab is generally indicated for the person who has allergy induced bronchospasm or asthma. Dosage forms available as powder for injection. Mechanism of action selectively binds to the IgE and inhibits the binding of IgE receptors on surface of mast cells and basophils. Adverse effect of omalizumab includes gastrointestinal distress, injection site reactions, headache, and severe thrombocytopenia. This severe thrombocytopenia is reported as a post-marketing reports. After the post-marketing reports, the use of omalizumab is leads to severe thrombocytopenia. Contraindications, hypersensitivity, risk of anaphylaxis may occur up to 24 hours after any dose or maybe after first dose. Risk of anaphylaxis may occur up to 24 hours after first or any dose. Cautions, not this omalizumab not for use in acute bronchospasms or status asthmaticus. The children less than 6 year, safety and efficacy of omalizumab not established, so it is recommended to avoid the use in the children less than 6 year of age. Anti-inflammatory role of theophylline, as we discussed in the previous lecture. Theophylline is a bronchodilator, but in addition to the bronchodilator, theophylline also has anti-inflammatory effect. Theophylline affects the function of number of cells involved in the inflammatory process associated with asthma and chronic obstructive airway disease, that is COPD. Third objective of our lecture, drug-drug interactions of drug used in the treatment of asthma and COPD. Let us see the drug-drug interactions between inhaled corticosteroids, fluticasone and budesonide. Ritonavir, which is the antiviral drug, highly potent cytochrome P453A inhibitor, which inhibits the enzyme cytochrome P453A4. Ritonavir 100 milligram bisin means 2 times a day increase the fluticasone propionate plasma concentration several hundred-fold, resulting in marked reduced serum cholesterol concentrations. Sorry, marked reduced serum cortisol concentrations, which results in Cushing syndrome and adrenal suppression. So the patient who are using ritonavir antiviral drug plus fluticasone and budesonide inhalational corticosteroid simultaneously may results in Cushing syndrome and adrenal suppression. Because ritonavir is inhibits the cytochrome P453A4, and fluticasone is also metabolized by the cytochrome P453A4 enzymes. If the enzyme is not available, the metabolism of fluticasone and budesonide not achieved. If this fluticasone and budesonide is not metabolized, its result in increase in the plasma concentration several hundred-fold and increase in the corticosteroid plasma concentration results in reduced serum cortisol concentrations. We can say negative feedback mechanism, because there is increase in the concentration of exogenous steroid. So endogenous steroid cortisol secretion will be reduced, and its result in Cushing syndrome and adrenal suppression. So the ritonavir antiviral drugs and other drugs which is metabolized by cytochrome P453A4 should be avoided simultaneously with the inhaled corticosteroids, that is fluticasone and budesonide. Drug-drug interactions of montelukast and zafirlukast, which is leukotriene receptor antagonist. Montelukast is a potent inhibitor of cytochrome 2C8, cytochrome 2C9, and cytochrome 3A4 enzymes. So, the drugs which are metabolized by these enzymes, including theophylline, prednisolone, oral contraceptives, including ethinyl estradiol, norethindrone, terfenadine, digoxin, and warfarin, may results in fluctuation of plasma concentrations, and thereby it affects the therapeutic level of serum concentrations of the drug that are metabolized by cytochrome 2C8, 2C9, and 3A4. So it is recommended, it's an recommended, the montelukast and zapirlukast should not be given simultaneously with the drug that are metabolized by the same enzyme, that are cytochrome 2C8, 2C9, and 3A4, to avoid the drug-drug interactions at pharmacokinetic level. These are references for further reading. I request you to read further by using these references. Thank you very much. Yes, question please. Any questions?